Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Okay, let's unpack this. We all have this picture in our heads, maybe from TV or just general culture.
hmm
The dad who's the rock, the steady one, always smiling when it comes to the kids.
The classic image.
Exactly.
Yeah.
But here's something that might surprise you. Between 8 and 13% of fathers in the United States experience some form of depression during their child's early years.
Wow, that's quite a chunk.
And get this, that number jumps to a staggering 50% when the mother is also dealing with postpartum depression.
50%. That's huge. It really makes you think.
It really does. It makes you wonder about the whole story, doesn't it?
Absolutely. And what's fascinating, or maybe concerning, is that while we've looked quite a bit at the impact of mothers experiencing depression on their children,
Yeah, that seems well studied.
right, but the longer-term effects of fathers' depression, well, they haven't been as thoroughly understood. It's kind of a gap in our knowledge.
Which is where this new research comes in.
Precisely. This new research really starts to fill that gap.
Okay, so for this deep dive, we're looking at some really compelling new findings that explore exactly that, the long-term connection between fathers who experience depression and their children's behavior and how well they get along socially as they grow up.
Sounds important. What are the sources?
We've got some insightful information from a health news article by Rutgers Health, and we're also digging deep into the details of a research paper. It was published in the American Journal of Preventive Medicine.
Okay, solid sources.
Yeah. And if we connect this to the bigger picture for you listening, it becomes pretty clear why this matters so much.
It's not just about the dads themselves.
Not at all. We aren't just talking about the well-being of the fathers, but also about how their mental health might, shape the development of their children.
So our aim today
Is to really understand what this research tells us and what it could mean for families and the people who support them. And we'll try to do it without getting totally bogged down in overly complicated science talk.
sounds like a plan. So let's dive in. The study itself, what was the main question they were asking?
What were they trying to figure out?
Yeah. The main goal, really, was to examine if there was a link between fathers who had symptoms of depression when their kids were about 5 years old.
Right around kindergarten age.
Exactly, just starting kindergarten. And then looking at any behavioral difficulties or maybe social skill challenges those same children might have when they reached age 9. But based on what the teachers were seeing.
Teacher reports.
No.
Okay. 5 and 9, that's an interesting window. Why focus on that particular period?
Well, the researchers themselves point out that starting kindergarten is a really significant time in a child's development, a big transition.
Makes sense.
And any difficulties a child faces then, well, they can unfortunately have a kind of knock-on effect as they go through school.
Right. Sets a trajectory, maybe?
Could do. And like we mentioned, a lot of the previous work focused on moms, or maybe dads, but only right after the baby was born, the postnatal period.
So this looks later.
Yeah, this study specifically aimed to look at that later stage, around kindergarten entry, which hadn't been explored as much for dads.
Okay, so how did they actually do it? What was the methodology?
They used information from a really valuable long-term project. It's called the Future of Families and Child Wellbeing Study.
Oh, I think I've heard of that. FFCWS.
That's the one, though we'll try to stick to the full name. It's a national study that started by looking at births in 20 large U.S. cities between 1998 and 2000.
Oh, okay.
And what makes it so useful is that they've kept following these families, collecting data from them over many, many years.
So it's a really in-depth look at these families' lives over time. That kind of long-term data must be incredibly useful.
It absolutely is. For this specific study, they zeroed in on 2 key pieces of information gathered by the Future of Families study. First, they looked at fathers' symptoms of depression during the previous year. And this was assessed when the children were 5 years old. They used a standard questionnaire developed by the World Health Organization, the Composite International Diagnostic Interview short form, I believe.
Right, a recognized tool. That sounds like a well-established way to understand their mental health. And what was the second piece of info they looked at?
The second was how the kids were doing in school when they were 9, specifically their behavior based on reports from their teachers.
Not just the parents' view, but the teachers.
Exactly. These reports were gathered using 2 different standardized rating scales. One's called the Connors Teacher Rating Scale Revised short form,
Okay.
and the other is the social skills rating scale.
So they're getting perspectives from teachers who see these kids day in, day out in a different setting. That seems like a really important viewpoint to include.
Absolutely crucial.
Okay.
So the researchers then compared this information for over 1,400 fathers and their children, 1,422, I think it was.
Wow, it's a decent sample size.
It is. And importantly, they also took into account a whole range of other factors, things that could potentially influence both a father's mental health and a child's behavior.
What sort of things?
Things like the family's income, parents' education level, race, ethnicity, and critically, whether the mothers also experienced depression.
Ah, so they tried to separate out the father's influence.
Exactly. It helps them get a clearer picture of the potential impact of the father's mental health specifically.
Makes sense. Can you tell us a bit more about what those teacher rating scales actually measure? What kind of behaviors were the teachers reporting on?
Sure. The Connors scale looks at a range of behaviors. It assesses things like how defiant a child might be, whether they argue a lot.
Oppositional stuff.
Right. Also, if they're hyperactive, any symptoms related to attention deficit hyperactivity disorder. And it looks at issues with focus and concentration, too, cognitive problems or inattention.
So it covers both those sort of outward, more disruptive behaviors and also things related to attention and learning.
Precisely. Then the social skills rating scale, well, that focuses more on how kids interact with others.
Okay.
It looks at positive social behaviors like how well they cooperate, how they assert themselves healthily, their self-control.
The good stuff.
Yeah. And it also assesses problem behaviors. It splits them into externalizing behaviors like aggression, acting out and internalizing ones, like anxiety or seeming withdrawn.
Okay, that gives us really good understanding of the measures they used.
Mhm.
So after crunching all this data, what did they find? What were the big takeaways?
Well, the study revealed some pretty significant connections. They found that children whose fathers had reported symptoms of depression back when they were 5
Yeah.
were noticeably more likely to show signs of restlessness, defiance, and anger by the time they were 9.
Wow. Okay.
And these children also tended to have lower levels of cooperation and even self-esteem, according to the teacher reports.
That's a pretty strong link they're suggesting. Were there any specific areas where this connection seemed, particularly pronounced?
Yes, definitely. When fathers reported depressive symptoms around that kindergarten entry time, their children had significantly higher scores on teacher reports of oppositional behavior, about 36% higher.
26%. Okay.
They also saw a 37% increase in hyperactivity scores and a 25% increase in scores related to attention deficit hyperactivity disorder symptoms.
That's interesting.
But interestingly, after they adjusted for all those other factors we talked about, they didn't find a significant link with cognitive problems or inattention.
So it seems to be more focused on the behavioral and social emotional sides rather than, say, focus in class.
That seems to be what this data suggests, yes. Looking at the social skills rating scale, they found that kids whose fathers had been depressed had scores that were 11% lower overall in positive social skills.
Lower positive skills.
Yeah. And this pattern was pretty consistent across the specific areas: cooperation, assertiveness, self-control, all down a bit.
And on the flip side, problem behaviors.
Right. Those children had scores that were 25% higher in overall problem behaviors.
Okay.
And that included increases in both those externalizing, acting out types and the internalizing, more withdrawn types of behaviors.
And the researchers felt confident these links weren't just due to other things, like maybe the mother also being depressed or family stress.
That's a really critical point they addressed. The study specifically controlled for various characteristics: the child's, the father's, the family's background, and importantly, the mother's mental health.
Right.
And the fact that these connections, these associations, remained significant even after accounting for all those other variables, that really strengthens the argument that there's a distinct link here between paternal depression at that kindergarten point and these later outcomes.
So this really underscores how crucial it is to consider the father's mental well-being, not just focus on the mother.
Absolutely.
So what are the bigger implications of these findings? Why should this research matter to us beyond just the statistics?
Well, Dr. Christine Schmitz, who led the research,
Ah, yes, the lead author.
she described the findings as providing a definitive link, her words, a definitive link between paternal depression when kids start school and how they behave in school a few years down the line.
definitive link. That's strong language.
It is. And she highlighted that, many previous studies might have relied on parents reporting on their own kids, which can be subjective.
Sure.
Or they might have looked at smaller, maybe more specialized groups. The size and design of this study really add weight to the findings.
And as we touched on earlier, that kindergarten period is such a key time for kids.
Absolutely. It's a major developmental milestone. Difficulties that pop up or are already there around that age can really shape a child's whole experience throughout their school years.
You can see how that would ripple outwards.
Definitely. And if we think longer term, we know that children who experience these kinds of behavioral problems are, unfortunately, at a higher risk for a bunch of challenges later on.
Like what sort of challenges are we talking about?
Well, things like struggling more academically in school, having a harder time making and keeping healthy friendships, peer relationships, and being more likely to engage in risky behaviors when they're teenagers.
Okay.
And looking even further ahead into adulthood. These early behavioral issues have also been linked to poor mental health later in life, less success in education and careers, financial difficulties, even worse overall physical health.
Wow. So the stakes are actually quite high.
They really are. Addressing these issues early on, supporting kids and families, it can potentially have really significant and lasting positive effects down the road.
It really brings home that idea, doesn't it? That we need to think about the mental health of both parents.
Yeah.
Not just primarily focusing on moms when we're concerned about the whole family's health and development.
Exactly right. One parent's mental health doesn't exist in a vacuum. It can have really significant interconnected effects on the entire family system.
Yeah, absolutely. Now, of course, with any research, it's important to think about limitations. Were there any aspects of this study that the researchers themselves flagged as, things to keep in mind when we interpret these results?
Yes, definitely. They were upfront about a few limitations, which is good science. One was that families where the fathers had lower levels of education and those who belonged to racial or ethnic minority groups were less likely to stay in the study over the long haul.
Ah, attrition. So the sample might have become less representative over time.
Potentially. It raises the possibility that the results might not perfectly reflect all populations. Though the researchers mentioned it's not entirely clear exactly how this might have skewed the specific links they found.
Okay. Still something to be aware of. What else?
Another key thing is remembering this was an observational study.
Meaning it shows correlation, not necessarily causation.
Precisely. While it can show us that paternal depression and later child behavior problems tend to occur together, it can't definitively prove that the depression caused the behavior problems.
All right, it could be more complicated.
It could. For example, it's possible that children who are already having some behavioral difficulties might have, in turn, contributed to their fathers experiencing more stress or depressive symptoms. The relationship could be bidirectional, more complex.
Well, that makes sense. It's not always a simple one-way street.
Another limitation is that the study couldn't really dig into how severe the father's depressive symptoms were, or for how long the children were exposed to them.
The dose-response idea.
Exactly. The intensity and the duration of the depression could certainly play a role in the impact on the children, and this study couldn't capture that nuance.
And were there any considerations about the teacher reports themselves?
Yes, the researchers did acknowledge the possibility that teachers might unintentionally rate problematic behaviors more frequently among children from certain minority groups or lower-income backgrounds. Stereotypes or biases could potentially play a role.
That's a tricky issue in school-based research.
It is. However, they did try to address this, first, by including a diverse group of families to begin with, and second, by statistically controlling for factors like race and socioeconomic status in their analysis.
So they took steps to mitigate it, but it's still a potential factor to keep in the back of our minds.
Exactly. And one final point, the data on the kids' behavior at age 9, that was collected quite a while ago now, between 2007 and 2009.
Oh, right. So over a decade ago.
Yeah. The researchers acknowledged that, societal norms, awareness about mental health, things might have changed for different groups of kids since then, so the findings might not perfectly mirror the situation today.
Good point. It gives us a really valuable snapshot from that time, but things evolve. Now, you mentioned the lead researcher, Dr. Christine Schmitz. What were some of her key takeaways or thoughts on what these findings really mean?
Dr. Schmitz really hammered home that critical point we've discussed.
Yeah.
We absolutely need to consider the mental health of both parents, not just mothers. She stressed that depression is treatable. That's such an important message. And for the benefit of the whole family, it's essential for healthcare providers, especially pediatricians, to start having these conversations with dads about their mental well-being
Talking to dads about it.
and developing support programs, interventions that are specifically designed to meet their needs, not just assuming what works for moms will work for dads.
That point about depression being treatable is huge, isn't it? It offers a path forward.
Absolutely. It's a message of hope. She also highlighted how when fathers are struggling with depression, it can naturally affect their parenting, maybe leading to less emotional support for their kids.
Hmm.
And she noted it can contribute to more conflict, more stress within the home environment, which, obviously impacts children.
So it's not just about the father's internal struggle, but also how that can manifest in family interactions.
Exactly. It affects the whole system.
Yeah.
Dr. Schmitz expressed her hope that by identifying these issues early, by providing support when fathers are struggling, we can significantly improve the well-being of both the fathers and their children.
A double benefit.
Right. And she brought up a really interesting idea about parents being role models when it comes to seeking help, didn't she?
Yes.
Tell us about that. She suggested that when parents openly reach out for support during tough times, they actually teach their kids a really valuable lesson.
How so?
It shows them that it's okay to ask for help when you're struggling, that it's a sign of strength, not weakness. That can be a very powerful example for kids to see.
That really reframes seeking help, doesn't it? From something maybe seen as negative or stigmatized to a positive demonstration for the next generation. I like that.
Me too.
So pulling all this important information together, what are the next steps? What's the main call to action coming out of this research?
Well, the research strongly suggests we need to get serious about developing and implementing programs. Programs specifically aimed at identifying and supporting fathers who are experiencing depressive symptoms,
Okay.
and also providing support for their children who, as the study shows, may be affected.
And Dr. Schmitz specifically mentioned pediatricians playing a role.
Yes, she did. Because pediatricians see families regularly, especially during those early years for checkups. They're actually in a really good position to screen fathers for depression.
Makes sense. They're a trusted point of contact.
Exactly. Building that trusting relationship is key. But the reality check is that in the U.S. right now, it's still pretty uncommon for fathers to be routinely screened for depression during pediatrician visits.
That does seem like a massive missed opportunity, doesn't it? To connect with dads and spot potential issues early.
It really does. The American Academy of Pediatrics, they already recommend screening fathers for depression during the perinatal period, that time around the birth.
Right, the immediate postpartum phase.
Yeah. But based on these findings showing effects years later, there's a strong case to be made for extending that screening, making it a more regular part of pediatric care, well beyond just the first year.
So making it a more consistent part of the ongoing conversation about family well-being, not just a one-off check.
Precisely. And beyond screening, there's a clear need to develop actual support programs designed for fathers.
Tailored to them.
Right. And perhaps even exploring programs that could be implemented in school settings to provide support for both the children affected and the families dealing with paternal depression.
It sounds like a multi-pronged approach is needed. Healthcare, schools, maybe community support too.
Absolutely. A comprehensive strategy. And that kind of leads us to a final thought, something for you, our listener, to maybe chew on.
Okay.
Given how significant the impact of fathers' mental health seems to be on their children's development, the next generation, what broader changes might we need in society to better support fathers and families?
Good question.
Yeah. What questions does this deep dive raise for you about the kinds of support systems, or maybe the lack thereof, that are currently available to fathers in your own community? It's definitely something worth giving some thought to.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.